Welcome to another ElderWatch mini-series. This time, we're going to talk about Medicare basics. Medicare is a federal health insurance program for individuals 65 and older, but in some cases, for example, depending on certain health conditions, you might be able to get Medicare before you turn 65. Today, we're going to be talking about what I'm calling the alphabet soup of Medicare, by which I mean we'll be talking about all of the different letters associated with Medicare. Today, we're going to talk about Medicare Parts A, B, C, and D, and we'll also touch base on Medigap plans A, B, C, D, F, G, K, L, M, and N. Whew. Though ElderWatch does not provide financial or legal advice, at the end of this video and in the description of this video, I will post some links and share some resources that might help you navigate Medicare and make the right choice for you. My name is Jessica Zawadsky. I am the Program Specialist for ElderWatch Colorado. Let's get started. There are lots of letters when it comes to Medicare, and in some cases, the letters on these plans are used more than once, making things even more confusing. For example, there's Medicare Part A, but there's also Medicare Supplement Part A, and those are not the same thing. Today, we're going to look at Medicare Parts A, B, C, and D, and then after that, we're going to talk about some of those Medigap plans. So Medicare Parts A, B, and D are parts of traditional Medicare. Medicare Part C is Medicare Advantage. So on the traditional Medicare side, in general, Medicare Part A helps pay for inpatient care you get at hospitals, critical access to hospitals, and skilled nursing facilities. It also helps cover some hospice care and some home health care. In general, the cost for Medicare Part A is $0 as of this recording, which is in February 2026. And for most people, this is because they or their spouse paid Medicare taxes long enough while they were working, generally at least 10 years. Medicare Part B is medical insurance, and it covers two types of services. Medically necessary services, which are services or supplies that meet certain standards of medical practice to diagnose or treat a medical condition. And the other type of service is preventative services that aim to prevent illness or detect it at an early stage when treatment is likely to work the best. Part B may also cover things like durable medical equipment, preventative care visits, blood work, and diagnostic tests. Medicare Part D is prescription drug coverage. It helps pay for brand name and generic drugs. And even if you're not taking any medications, it's a good idea to at least consider getting Medicare drug coverage, because if you try to enroll later, you might face a penalty. Now that we've covered Medicare Parts A, B, and D, let's look at Part C, which again is not part of traditional Medicare. Medicare Part C is Medicare Advantage, and it is a completely separate plan from that traditional Medicare. Medicare Advantage is a type of Medicare plan that is offered by Medicare-approved private companies, and it generally combines Parts A and B. Many Medicare Advantage plans also include prescription drug coverage, which is Part D. Generally speaking, Medicare Advantage and traditional Medicare differ in their costs, which doctors and hospitals you can use, whether you'll be covered if you're outside of the area you live. So for example, we're in Colorado. If you're in New York, depending on which plan you have, you may or may not be covered when you go visit New York. These plans also have different inclusions and exclusions. Choosing Medicare Advantage versus traditional Medicare is a very personal choice, and there's a lot of pros and cons between these two plans. On the screen here is Medicare.gov's side-by-side comparison of these plans, and I'll put a link to this page in the description of this video. Now that we've covered Medicare Parts A, B, C, and D, let's talk about the other letters you might hear, which are generally Medigap or Medicare Supplement plans. Medigap is Medicare supplemental insurance sold by private companies that helps fill the gaps in original Medicare coverage. So note, this is not for Medicare Advantage, just for that traditional Medicare. As of this recording, there are 10 different types of Medigap plans offered in most states, and these are named by the letters A through D, F, G, and K through N. Now let's look at a side-by-side comparison of each plan, but to learn more about the differences between the Medigap supplements, go to medicare.gov. The table on the screen is from medicare.gov, and the screenshot was captured in February of 2026. As you can see, all of these Medigap plans are a little bit different, and this table compares them across many categories such as Part B coinsurance or copayment, blood benefits, hospice care, coinsurance, copayment, out-of-pocket limits, and more. The link to this table will be posted in the description of this video. Medicare can be very confusing and it's very complex. In some cases, the choices that you make today or when you're first enrolling will have an impact on your future coverage as well as the changes that you'll be able to make down the line. If you need help navigating your specific Medicare needs, you can contact the State Health Insurance Assistance Program, which I'll be referring to as SHIP. SHIPs provide local, in-depth, and objective insurance counseling and assistance to Medicare-eligible individuals, their families, and caregivers. Their mission is to empower, educate, and assist Medicare-eligible individuals through objective outreach, counseling, and training. If you need to contact your SHIP, you can call 1-888-696-7213 for English, and for Spanish, you can call 303-894-5953. If you'd still like to learn even more about Medicare, check out AARP. You can learn more about Medicare at aarp.org/Medicare. And you do not need to be an AARP member to view many of the resources found online. AARP.org/Medicare offers information about managing costs and coverage, open enrollment, annual changes, advocacy efforts, and more. That's a wrap for today. For all of us at ElderWatch, thank you for joining me. We'll see you next time. Bye.